Welcome everyone to the first EFPC webinar series for 2024. I am Robin Kholos. I'm the Junior Coordinator for the forum. And today I'd like to welcome Dr. Sean Owens, who will be talking about, he will be having a discussion on greening our practice, speciality and own lives in society, incorporating insights of the Climate and Health Alliance and the ICGP Sustainability and Planetary Health Working Group. Dr. Sean Owens is a full-time GP in practice. Sean has an interest in lifestyle medicine, sustainable diets, and planetary health. Hailing from County Down, he initially studied pharmacy at Queen's University Belfast before electing to study graduate entry medicine in Dublin from 2010 to 2014. Sean is a member of the Irish Society of Lifestyle Medicine and Irish Doctors for the Environment. He also chairs the ICGP Sustainability and Planetary Health Working Group, who established the GLASS Toolkit for making primary care more sustainable on Earth Day in 2023. In 2024, he was invited to chair the Irish Climate and Health Alliance. So please welcome Dr. Sean Owens, and we are looking forward to the talk you're going to give us today.
Well, thank you very much, Robin. And just a little bit of context. My first encounter with the EFPC was last autumn at the European Public Health meeting in Dublin. And it was a small meeting, and it really did make an impact. I think these small conversations that we have can be kind of, a turning point. So I was so impressed, and that's how I became involved with your work. So when I was asked to maybe share some thoughts on Ireland and sustainable healthcare, I thought the usual thing, I'll tell you what we're up to. But as I dwelled on it, I thought I'd maybe try something a little bit different. And that is really a bi-directional conversation that I hope I have time for at the end. And that is something I struggle with, is how are we supposed to act on climate change? How are we supposed to make the healthcare that we deliver more sustainable? As Timothy Morton, the philosopher, calls climate change a hyper object. It's a lot to get your arms around, and it can feel a bit overwhelming. So as you can see, I work as a full-time GP. I'm a chair of the Irish Climate and Health Alliance, also the Irish College of GPs working group, and a few other groups, Irish Doctors for the Environment, Lifestyle Medicine, and so forth. But it's really all the same story. It's the different sides of the same coin. So if you can just flick on one, please, Robin. This is by way of saying, well, probably the most important slide I find now, as with my accumulated years, is that it's the conflict of interest declaration. Who is this person? What are they trying to sell me, or what are they not telling me they're trying to sell me? Well, certainly I don't have any conflicts to declare. There's no money in climate advocacy, I found. But I always maybe just use this as an anchor point. This is, of course, an image of Earthrise by Will Anders, the astronaut. And Will and many other astronauts have reported a reproducible phenomenon called the overview effect, where coming back to the planet, they feel a renewed kinship. They can see the atmosphere for the thin layer that it is, not this expanse that we look up to. They understand not just a feeling of deep space about how vulnerable the planet is, but they also feel a kinship with deep time, and they realize that everything that's ever happened, whether it's the Industrial Revolution, or if it's Genghis Khan, the Great Wars, they were just really very recent. They were just there now. Everything that's happened in human history is quite recent, and they come back with this this overview effect, as I said. So the challenge for me today, and really for me on a daily basis, is to bring some of this overview effect into my daily life, into work, and into advocacy, and realize that we do live in a remarkable time when our actions will have profound sequelae for future generations. Next slide, please. Just speaking about deep time and space, this is where I'm talking to you from today. Just hit on twice, if you don't mind, Robin. So the dark green place on the right is County Louth. It's called the Wee County. It's the smallest county in Ireland. It's halfway between Dublin and Belfast. And on the left, that's the village where I live, and that is called Blackrock. So I just want you to have a wee look at that, if you don't mind, and maybe if you can put in the chat, what does that say to you? What does a seaside village say? Does it say ice cream, family time? Does it say water sports, wildlife? I don't know. Because it's something I've been kind of considering, and I hope to come back to this at the very end of the presentation. So that's where I live. It's nice to live somewhere coastal and blue. Next slide, please. I spoke about deep time. Well, um, over this conversation, I want to talk a little bit about the context. Why am I concerned about climate change? And then finding this middle ground. What road do we take? The high road, policy? Do we focus our efforts there? Or do we concentrate on what we can achieve at a practice level? Or perhaps we should be spending the majority of our time on being the best person that we can be at a personal level. And then I'll tell you a few stories and we'll have a discussion. Next slide. So this is Will Pickles. He's the first chair of the Royal College of GPs in the UK. He practiced about 100 years ago. And a few things about Will that stand out to me. Well, he's a bit of a hero to me. And when I finished postgraduate family medicine training, I was given this book. It's called Will Pickles of Wensleydale. They are Yorkshire deals. Well, a few things. He practiced at a time before antibiotics. Let's go back there. He practiced at a time before antibiotics, before electricity, in fact, and he would go from deal to deal on his bike. And on the front of the bike, he'd have a little shelf with his obstetrics bag. And of course, perinatal mortality was much higher. But the other thing I say is he's happy. He's really happy. He's a pillar of the community. And behind him there in his surgery, he's got a great big chart where he was able to track things like exanthems and determine things like new infectious diseases, scarlet fevers, and even come up with things like R numbers. So he's well ahead of his time. And a few things there is he is using relatively low tech but very high yield technology. Conversely, a lot of the technology we have today is high tech but relatively low yield. And I think going forward in an energy insecure society, we have to start thinking about what is worth doing now and what are those low tech but high yield interventions that we may lead upon. And with antimicrobial resistance, it might not be unfathomable that we have a healthcare system, maybe even in our generation, that isn't so far from Dr. Pickles. And it was just recent. Okay, next slide, please. And you can hit on it 2 more times, please, Robin. These are major reports that have informed me. The IPCC report, the Eat Lancet report, the IPBS report, saying that we're living in a time of mortgaging the future of tomorrow for today's diet, or the human emissions are changing the planet, or that we're living in a mass extinction. Now, these are the executive summaries. They're not my paraphrasing, but they do have a limited time. They make some news at the time, and then they tend to filter away, and a normal service resumes. So I have been, when talking to colleagues, trying to find other ways to inform us of planetary health, the climate crisis, biodiversity crisis. And one is this issue of tipping points, and a review by Linton et al. I really like the tagline saying it's too risky to bet against. So in Ireland, the Atlantic circulation would be a big one. We're completely dependent on the Gulf Stream for our temperate climate, agriculture, and so on. But it's very hard. There's a lot of uncertainty about when permafrost will thaw and what that will mean for global warming. But the downside is so vast that it really is incumbent that we listen to these warning shots, I think. Next slide, Robin. And one that informs me, one tipping point is Arctic ice. And just to bring it back to the personal, the first biography I ever read growing up was by someone called Ranulph Fiennes, Sir Ranulph Fiennes, and he was an Arctic explorer. And he went with his sled across the North Pole. And I remember at the time the ice was so thin, they had great difficulty getting there, but they did. And that was really inspiring growing up to hear about these great adventurers. And of course, over the last 20 or 30 years, we've seen a waning of Arctic summer ice, that this is something no longer possible. Next slide there, Robin. This is not NASA imaging there to show this. And we can see that since 1980, that's the year I was born, Arctic ice thickness has completely fell away. So this is a loss. And it's now estimated that maybe in the next 10 or 15 or 20 years, we will have a summer without Arctic ice. And that really shakes me. This is a geological epoch that we're going to see in our lifetimes, most likely. What does it mean? Next slide, please. Another way I've tried to translate the climate crisis to colleagues here in Ireland is by looking at another way of looking at it is planetary boundaries. So the green bit in the middle, of course, is the planet, and the red bits coming out are overshoot. So in medicine, we routinely trust our instruments. And if this planet was a patient, we would certainly say they're decompensating. And a few things about that, we'd say, well, probably this patient needs not just the emergency department, but intensive care. And the second thing is to say the conversations we would have would probably be a little bit different. And we would probably be asking, what's the best that we can do for this person now? What's the most appropriate use of resources? And what is worth doing now? And that's certainly where I'm starting to think about planetary health and sustainability. What is worth doing now? That's what I'm talking about, this middle ground. So next slide there, Robin. I'm going fast because I think people mostly know a lot of this data. So it's really just to inform myself. The other one I'm informing myself about is a few landmark papers that have really shook me. And this is one by Hickman and colleagues. It was a global survey of climate anxiety of teenagers, and we are seeing a lot of teen mental health issues, screen time, sedentary behavior, but also climate and nature related. If you hit on the next slide, and I hit it a couple of times, I think, Robin. A few excerpts from this. They say that, children, adolescents from around the world feel sad, afraid, angry, powerless. Climate change, anxiety, and inadequate responses are chronic stressors that will undermine the mental health of, the next generation of healthcare professionals, policymakers, leaders. And the sign-off, as you know, in academia, quite often the sign-off paragraph is a little bit dry. But this is, as a research team, we were disturbed by the scale of emotional and psychological effects of climate change upon children. And we wish these results had not been quite so devastating. This is certainly something I'm starting to see in consultations. Teens, teenagers, and young adults. Next slide. So this is Harry with the blonde hair, and that's Austin on the right. Harry is 7, Austin's 5. These are my our two children. And it's certainly bringing those, landmark international reports back to the personal. What will this mean for them growing up? And I'm starting to see it in our conversations. So if I ever remonstrate with them at the breakfast table, don't hit your brother, I'm accused of being bad for the environment. If I don't give in to sweets or pizza or whatever, I'm bad for the environment. So they're starting to hoover it up already. They're not yet 10. So I think this is something that I'm aiming to reframe, that their relationship with nature and the environment and the climate crisis is a positive one. Next step, or next slide. Another way I've been trying to inform my colleagues is to think, well, if you're not into climate change, if you don't really buy in or you're not motivated, think about your own future, your own financial future. And there's growing reports from actuaries, from pension funds, from investment banks, that a lot of the models they are using, and I know someone who works in investment banking, said their models say the business as usual with fossil fuels and biodiversity loss will mean business as usual for growth. And I don't see that. I think we're reading different reports, and we're starting to see more and more evidence that our financial futures is in jeopardy just as much as our climate ones. So climate action is good for our own positive mental and physical health, but also for our financial health. Next slide. And this is aerial data of Loch Ness. It's the largest inland body of water in Europe. It's in Northern Ireland. And what we're seeing here, this green is an algae bloom. All of the land around Loch Ness, and there's about 6 counties that border it, this is close to where I grew up, is all heavily agricultural. So a lot of the nutrient runoff, it's called eutrophication, has caused in the last few years these huge algae blooms to the point where pets are advised not to drink this water. We're having large fish kill-offs. Well, this is the predominant source of drinking water for Northern Ireland. It's been likened to the political system, eutrophication of the political system in Northern Ireland. That's for another webinar, I think. But this is for me the definition of planetary health. It's the natural, it's our own health based upon the natural systems upon which we depend. And I include this to say, well, it's not all about the Arctic, the tundra, the rainforest, the coral reefs. It's happening here in Ireland, and it's happening wherever you are. So there is a need to act at a local level. Next slide there, Robin, please. So that's the context. What about the middle ground I talked about? Well, there's a high ground, and that's the policy level. So I'll just talk a little bit about what is happening in Ireland with respect to sustainable healthcare. The first you'll see on the left is the Royal College of Surgeons has now produced a document about green surgery, how that works, how that looks. In the middle, you'll see last Earth Day, the Irish College of GPs published our green or gloss toolkit. On the right, you'll see an Irish Doctors for the Environment toolkit for how to prescribe inhalers more green. And probably the most important of all is the Health Service Executive last summer produced their climate action strategy. And since then, they've produced a host of working groups to enact that policy. So there's some top-down pressure, changes, movement. But you don't see it in your everyday consultations, so it's frustrating. Next slide there. As mentioned, I'm part of the Climate Health Alliance, and we've now produced a manifesto for health. It will be election year in Ireland, and our manifesto is not that controversial. We want 5 things. We want cleaner air. We want cleaner healthcare. We want space for nature. We want cleaner diets and cleaner modes of transport. These are all triple wins. Thanks for sliding on. That is something called the Joint Declaration for Planetary Health. There's a saying that common sense isn't common, but in the age of social media, Robin and colleagues, neither is consensus. And one thing that we've managed to do with the Climate Health Alliance is agree a consensus for action on planetary health. And here, all of our co-signatories, which I'll show you in a little minute, have signed up to a document saying that we will all act on planetary health. It's quite unique for healthcare institutions to speak to one another like this. I think you'll realize that. Next slide. I won't go through the whole document because it's a little bit dry, but what are we asking for in this declaration? We're asking for healthy lives, promoting health, well-being at all ages. That's not controversial, that's healthcare. Sustainability and a green environment. Well, it's 40 years now since Ulrich's green from health from a window, post-surgical view from a window, I think it was called, about how post-surgical patients recover faster. So it's not just green and biodiversity. It saves money and saves money that could go to better places such as social justice. Prioritizing green procurement sounds a little bit dry, but that's where all of the emissions are, the scope 3, the supply chain. And there's a lifetime's work in that. There's also a lifetime's work in challenging vested interests that spread misinformation. And the big 3, healthier diets, healthier travel, and stronger, more diverse communities. So that is what we've all signed up to, and we're going to launch that next Wednesday at a conjoint meeting between the Health Service Executive and the Environmental Projecting Agency. So we're starting to get more of this top-down policy actions. And then, of course, Wonka have now stepped in, and last summer, and I really felt this went under the radar, they redefined what quality family medicine primary care looks like. Same Wonka tree, all of the same branches. We are asked to wear all of the same hats as always, but we are now rooted in a bedrock that is planetary health, sustainability, and One Health. Well, this is a game changer for me. Next slide. And I'm really proud to say one of my colleagues, 2 of my colleagues actually in our working group, Andre Rochefort, who's also the president of EQIP, and Oisin Brady Bates, who's part of the Vasco da Gama Wonka group, were co-authors of that working group. And then finally, I just want to talk about one of our landmark reports the Climate Health Alliance produced. Again, this was released last May, and it's the first time that Irish healthcare has had a consensus statement on diets. Next slide there. It's called the Fixing Food Together report. And these are our co-signatories, and this is the power of the Climate Health Alliance. We've got the Royal College of Surgeons, the Irish Heart Foundation, Asthma Society, Royal College of Physicians, some of the major academic institutions, and they're all saying the same thing, that there's a lot we need to do with diets. I don't have time to speak to this report too much, but if you just skip on to the next slide, Robin, I'll tell you just some of the highlights. If you just skip on a few times, if you don't mind. The problem with Ireland is, of course, like everywhere else, there's too much ultra-processed foods and a lack of whole foods. We're one of the highest rates of people living with overweight and obesity. We do eat fruits and vegetables, but we don't eat enough beans, greens, and legumes. And we've got a high carbon footprint of our diet, but also water and ecological footprint. Next slide there. And yes, it says we have to have more of a plant-based diet, but much more than that. It starts with breastfeeding. It starts with ending the junk food cycle. These seem like easy wins, but to be honest with you, colleagues, healthcare institutions are very quiet on this. So there's a lot of room for action. Even if we were to eat to existing guidelines, we would save a lot of emissions and we'd have health gains. Reducing food waste, not just at a personal level, but with the big chains and at the farm level. And we've been quite bold and asked for improved agricultural practices. In fact, we went so far as to ask for a reduction in herd number. And that's quite a stretch for Irish healthcare to say that. And we've asked for a list of policy points. I think this is a personal deficiency. I'm not used to asking for policy change, but we've been bold and we've given our policymakers a list of requests. And again, if you just step on the next slide, this is better for people, better for the economy, better for the planet, and we can't extradite them all. They're all part of the same thing: planet, human health, and equality. So next slide there, if you don't mind. Okay, let's bring it back to the practice level. Next slide. What does sustainable healthcare look like in the practice? In my practice, the first thing is, if you engage in things like a park run or reproductive health, or you're involved in working groups about too much medicine or evidence-based medicine, or you work in areas of social deprivation, I would say you are already a planetary health champion. So there's much that we are already doing that is planetary health, climate action. We just haven't given it that title. Next slide there. The commonality for all of these big corporations is that they have mission statements, they have visions, and they all work towards them. This seems a little bit corporate and a little bit foreign to maybe a small family practice. But when I joined as a partner in our practice, the first thing we did, we sat down and said, well, what are we doing? And can we include sustainability as part of the work that we do on a daily basis? So next slide, if you don't mind, Robin. And this is our mission statement. We aim to be evidence-based, contemporary, and innovative. We're a training practice. We deliver optimal quality care that is also sustainable and mindful of our resources for the benefits of our patients and the community now and in the future. So it's not an overt green practice as such, but we are including it in our activities. And when we have decisions to make about whether we will embark upon some new service or business venture, that's part of the decision. Is this part of our vision? Are we working towards it? The next thing to say is, but doctors' health, and my colleague, Dr. Andrea Rochford, is very strong on this. She's the ICGP lead on doctors' health. If we are stressed, if we are underslept, if we are overworked and burnt out, we'll make poor clinical decisions that will cost us not just patient harms, but emissions. So we've started to include a structured consultation as part of how to provide sustainable healthcare. This is the Calgary Cambridge model, but you may use neighbor or narrative medicine or whatever model of consultation you use. I think it should be evidence-based, and there should be workshops for us to hone these to see where we're missing cues, where we could do better. Every part of the Calgary Cambridge consultation is evidence-based. Next step there. Or next slide. So go back just one if you don't mind, Robin. I mentioned there the gloss toolkit. Primary care can be a little bit greener. You can just stop here actually if you don't mind, Robin. Last year, for example, we looked at the, actually 2 years ago in COVID, we looked at the inhaler part of this document. And next slide. We changed our patients over to much more sustainable dry powder inhalers away from the spray inhalers. I think most of you will recognize that there's huge emission savings. Two things from that. Well, number one, our small practice managed to save 21,000 kilograms of carbon But moreover, in our chronic disease managed programs, we found that our patients are delighted with their improved care. So these triple wins: more sustainable healthcare. It's just usually evidence-based medical care in line with the GINA guidance, which changed in 2019. So that 21,000 kilograms is the same as driving around the planet twice, or charging 2 million smartphones, and we published it in the Irish Medical Journal. So next slide. The next way we bring planetary health into our consultations is through lifestyle medicine. Now, I don't have time to go through all of these, but I'll show you a couple of examples. So if hit on 2 more slides, please, Robin. If we bring, say, nutrition in, now it's cultural in Ireland for people when they turn 45 or 50 to come and have a checkup, know your numbers, get your blood pressure checked and your cholesterol. 2 more slides, if you don't mind. And the question is, should we bring lifestyle into that consultation? And the answer is absolutely yes. It's something we're not that comfortable with because of, well, maybe the medical model and how we're trained. But I've found there's a discomfort, and we published on this. So someone's in with high cholesterol. Should we talk to them about their diet? And the answer is yes. This is the most recent European Society of Cardiology Guidance 2021. And if you step on 1 or 2 slides, I'll show you what they have to say. And they're quite explicit. They say we should adopt a more plant-based diet for health. This is class 1, level A evidence, so we shouldn't be afraid of this. But as we endorse a diet that's higher in plants, we reduce not only carbon footprint of our patients, but the antibiotic footprint of their diet, the waste and ecological footprint, but also the ripple effect. And we see health gains not just for lipids, but for stroke, dementia, joint problems, and mental health, and all of the rest. So step on, next slide, please. Say somebody isn't that interested in your dietary advice, and incidentally, in Ireland, we have a chronic disease management program where anyone with respiratory or cardiac or diabetic illness are offered 2 consultations a year, and as part of that, there's a care plan. So we are now paid to have these conversations with patients twice a year. They may have an interest in something sporting or a hobby, and we can use social prescribing to enact this, because quite often we don't have the time or we don't know what's in our community. So previously I was just showing how our consultations can be a little bit linear. Of course, there's a lot going on in our conversations with the patient, but it's usually transactional, 2-way. When we bring another body in through a social prescriber or a link prescriber, it increases the complexity, and with increased complexity is increased resilience, not just for ourselves, but for our communities. So you can see here, we give our patient a slip or a referral note to a social prescriber. They take a more detailed history and find out what is in the community that they would like to do. There's follow-up, there's support, there's review, and then there's better outcomes. Next slide. The benefits of social prescribing are myriad. We can address social determinants of health. We can increase the capacity and the resilience of the voluntary sector. These prolonged follow-ups are how we might enact better behavior change rather than the annual visit that we have. It builds local community, it's cost effective, it's sustainable, and something that feels really good. Next slide. And if we're not into social prescribing, maybe we can talk about green prescribing. And this is now talking about the personal level. So I've talked about the policies, the big documents with all the shiny logos, and it feels good, but I'm not seeing it happen as fast as I want. I've talked about what happens in the practice, but what about a personal level? So I introduced you to Harry and Austin earlier. This is Austin playing on a tree. And the helicopter parent in me is worried he's going to fall in and hit his head and come to a sticky end. But a paper there is saying that, well, is it possible that rural children have larger hippocampuses? Of course, look at all the depth perception, the risk perception when kids are out playing on trees. So this is something that I've taken time to build into my day off, my weekend. Daddy wants to go and spend time in nature because I know this is going to be good for me and for them. I often think of nature as a bit like ultra processed foods. I'm not sure if the benefit of nature is the lack of screen time or if it's nature itself, but there's so much going on here in terms of proprioception, as I said, risk perception, depth perception. I can completely buy that their hippocampuses would be a little bit bigger and their amygdalas a little bit smaller. Next slide there, please. Well, this is myself, my son Harry, and my wife Irene, and we're out for a nature day in the local forest. And I don't want to medicalize everything that we do with a forest plot, but there is evidence that time spent in nature when other confounders are controlled for is associated with a reduction in heart disease and dementia, stress, and here type 2 diabetes. So this is not only a nice way to relax for the weekend, but this is a health gain. And I want, when I pass this message on to patients, for it to be authentic. So I'm trying to be my best self, going back to the consultation so I make better decisions. Again, we're still in this middle ground, trying to find where should I press, where should I spend my time? And I'm thinking about that overview effect at the same time. Well, I know that green spaces are better for our mental health, and a lack of green spaces is associated with loneliness and perceived shortage of social supports. So I've become involved with some local groups asking for improved green spaces, active travel, which is an important way to improve green spaces, and prescriptions to places like parks. We've also started a service called Woodlands for Health, where patients who come in with mental health issues are offered a 12-week program where they have a weekly guided walk in a local wooded area. And this has been mapped out all over Ireland. We're one of the last counties to enact it. And it's been shown to have really good effects on the WHO wellbeing scores. Next slide there. And then this is Powers Court Waterfall. This was about 2 months ago in the middle of a storm. And it is true that a sense of awe really does take you out of yourself. And I remember I was very stressed coming in this weekend because I had a bad week at work. And really within about half an hour or an hour of time of being there, I felt reconnected to nature. And that awe did really lead to me being a better healthcare professional, a better father, a better husband later on that week. So this is a tonic, absolutely a tonic. Next slide there. This is our local cleanup day about 1 month ago. And it's really interesting. All of the people you see in this, apart from Harry, Austin, and Irene, I'd never met before, but we all live within about 2 miles of one another. And this little bit of shore is about 100 yards from where I live. And it was really interesting. A lot of these people had lived in the village for maybe 4, 5, 10 years, and none of them have been to the shore. It was only that someone had organized a national litter clean day. We all put on our high vis. We went out and picked up some rubbish, and we had a cup of tea, and we all met. Well, this is a little bit like the microbiome. This is a multi-nodal network in action. This is what resilient communities look like. And for me, with all of those huge catastrophic climate change events that we have keyed in, the one thing we need isn't better seawalls. I think it's resilient communities. So for me, this isn't just a litter pick. This is climate action. This is climate mitigation. This is adaptation in action. So next slide there, please. And there's so much on our doorstep. So this beautiful tree is an elm. For any tree lovers out there, you'll know that an elm this size is quite rare. Dutch elm disease came to Ireland about 40 years ago, and most of the elms are now gone, but not this one. And what's really unique about it is it's in the back garden of our surgery. And you can see there, we found that it was tagged. So we phoned the tree registry office in Dublin, and we talked to someone who's doing a PhD in trees, and they were so excited about this elm. Well, now it's a resource. I now have kinship with where I live. This tree was here long before me, long before William Pickles, and it'll be here long after I'm gone. In fact, we've now written about it. We've told our patients about our tree, and we've put a little bench out the back for people who want to wait out there by it instead of in the waiting room. Next slide. So that's part of resilience as well. And at a local and a personal level, I've tried to enact this. So this is Austin again. He's dressed up as a leprechaun for St. Patrick's Day, and he's pointing to a little greenery patch, a pocket forest. We know that feeling connected to nature can induce comforting emotions, positive affect, happiness, feelings of vitality, and a sense of meaning and purpose in life. Robin, colleagues, I often come home from a day's work feeling robbed of all of these feelings. So this little pocket forest is a micro tonic. And that little yellow bench is where I was just a couple of minutes ago before coming up to talk to you. And I was really hoping to speak to you from the bench, but it's too windy. Well, that used to be a car parking spot. Next slide. And a year ago, we sold a car and we replaced it with a cargo bike. So going back to Will Pickles, this is low tech, high yield. So a bike isn't very high tech. Um, it saves us a lot of motor tax and all that. We still have a car, but we're now a one car family and we've gained all these green spaces and we wouldn't trade it back. So these are personal decisions that I hope add to the authenticity whenever I'm talking to patients. Next slide there. So I've talked about this middle ground. What are we doing at a policy level, at a practice level, and a personal level? Here's what else is happening in Dublin. Through the stealth of COVID lockdown, this street called Cable Street in the city centre was pedestrianised. It used to be a traffic nightmare and somewhere that you wouldn't really want to drive through because it was so congested. Now it's a space for meeting people. Now it's a space for eating and conversing. All these opportunities for community and health. And again, it's like the microbiome or the mycelium network in the soil. It's a multinodal system, and this is going to add to resilience that we badly need. Next slide. This is in Dundalk. A few years ago, this gable, the end of the a row of houses, was a big grey, boring side of a house. And a few years ago, the council gave this over to local artists. And they've now have this lovely funky image of St. Bridget. And since that, it's really got lots of attention and it's become an annual festival, the St. Bridget's Day Festival, lots of activity. Now, that might not be a health metric in its own, but it's a space for conversation. It's a space for nature. And as we progress, I'm starting to increasingly see the role of the arts and culture and sports and language and food in a resilient community and improved healthcare. Next step. So this is the quintessential book of climate crisis in the Irish context. And as you can see in the front cover, there is wind farms and cows. And certainly that's what dominates the reporting on climate change in the Irish context. And it's where all the emissions are, transport, energy, and agriculture. But what was really striking when I read this book is that the number one term used is community. Next slide there. It says climate change is a social issue. And as healthcare professionals and our prominent role in the community, there's a lot that we can say and do and be the inflection point that we need to be. Next slide. So this is a graphic of Indigenous thinking called sand talk or hand talk. And it's how they say, well, we need a lot of different values. The present metric of how we live and organize ourselves is quite heavily dependent on 4-yearly election cycles, on GDP, on the markets. Indigenous thinking says, well, we need our individual needs. We also have to think about family that have come and gone, future generations, culture, the environment, values and practices. If you hit on the next slide to see that this isn't a hark backwards. We're starting to see this increasingly called for now. So Kate Raworth's Donut Economics says we can have a modern economy, but we need to find a happy ground. This includes healthcare. All that we're asking is that planetary boundaries are